Uh, so the first 24 were hard. The next 16 were 17, 18 were easy. We're going to do a general Medicare review, but I want to just mention at the outset that this is a big subject, impossible to cover in an hour or even probably 10 hours. So we're just going to keep it narrowed down to one major theme. As we go through this, if you have any questions, feel free to ask, either send a chat to Allison or just unmute and ask me your question. I presume you can all hear me, right? Can everybody hear me?
Yes.
Good. Okay. You see in the slide here, it says, for a full explanation of Medicare, consult Medicare and You, which is a publication from Medicare. And I've given you the web address to get that booklet if you'd like to. And again, feel free to stop me as we go through this presentation. Ready to start? Everybody ready? Got your coffee? Got your drinks?
Yes.
Good. Okay. So the number one consumer complaint is they said I could see my doctor. A person was sold a Medicare plan and then went to see their doctor and found out their doctor wasn't in the plan, even though they were told they would be. Or a person was sold a Medicare plan and went to see their specialist and discovered that their specialist wasn't in the plan either. And according to the Center for Medicare Services, this is the number one consumer complaint in the United States. So we're going to talk about that. Okay, so now you see a slide, I hope, that says 2 ways to approach Medicare. Do you see that? Good. So, and hopefully you saw this other slide. Did you see this one? The disclaimer? Did everyone see that, or did I just fly right by it?
Yes, we saw it.
Good. Okay, great. All right. So there's basically 2 ways to approach Medicare. The first and traditional way is what they call original Medicare, Part A and Part B, Part A being hospital, Part B being doctors, plus a drug plan, because Medicare does not cover prescription drugs, plus a Medicare supplement, also called Medigap, which is meant to complement Medicare A and B so that you don't pay very much money out of your own pocket. So I'm going to go through that again, just in case there was too much information in one breath. So the most common choice for Medicare is what they call original Medicare, which is Medicare Part A hospital, Medicare Part B doctors. Then the consumer would purchase a drug plan because prescriptions are not covered by Medicare. And usually they purchase something called a Medicare supplement, also called Medigap. So it complements Medicare and keeps your personal medical expenses to a very, very low level, sometimes as low as 0. The second way people access Medicare is something called a Medicare Advantage plan, either HMO or PPO. So tell me if you've ever heard of, just raise your hand or make a sign if you've ever heard of Medicare Advantage. Good, we have one person. One person, okay. So does everybody know what an HMO is? Let me rephrase that. Does anybody not know what an HMO is? Very good. Does anyone not know what a PPO is? Is anybody being very polite and won't say either way? Okay, we'll move on. All right, so now let's talk about Medicare supplements. So when you have a Medicare supplement, that means you have original Medicare and you can see any Medicare doctor in the country. So it is the largest directory of medical doctors that you can possibly have through an insurance plan. You can see any Medicare doctor in the country, and it's just like you were in Los Angeles. So if you were vacationing in Chicago and something happened, no problem, go see a Medicare doctor. It's just like you were in LA County. And the directory of doctors, I don't know if there's a actual number, but it's hundreds of thousands of doctors available to you in a Medicare supplement. Most doctors are Medicare providers that you can see in your Medicare supplement. And most doctors are Medicare providers because the senior market is so large that it would be hard to be in business as a doctor if you didn't offer Medicare to your clients. Now, there are different kinds. I'm going to stop right there. Have I confused anybody so far? And please don't be shy.
So this is pertaining to option one, which would be Medicare plus Medigap plus drug plans.
Yes, and thank you for that. Any other questions or confusions at this point? Okay, good. Now, there are different kinds of Medicare supplements. Currently, the kind that has the richest benefits is called Plan G, which has been available to Medicare people since 2020. With Plan G, again, Plan G with Medicare, if you were hospitalized, you would pay zero for the covered expenses. So if you're in the hospital for a month and you walked out, the bill was $250,000, you would pay zero for the hospital portion of that bill, the room and board, and you would pay $226 for the doctor portion of that bill. So if the bill was $100,000 or $250,000 or $1 million, you would be handed the bill for $226. Does that make sense?
Yes.
Great. Now, with Medicare supplements, there is a monthly premium. And the monthly premium is based on your age and your location. And at the conclusion of today's meeting, if you want to send me an email with your zip code and your date of birth, I'd be happy to tell you what a Medicare supplement would cost. Any question at this point? Very good. Now, have you ever seen all these Medicare commercials on TV? Anybody ever see these commercials on TV?
Yes, too
Oh, yeah.
Oh, yeah.
Yes.
Good. Anybody getting any mail in their mailbox?
All day.
All
Yes.
day.
Yeah.
You get any phone calls from Medicare salesmen?
Yes.
Okay, now I'm going to tell you one thing about that. It's illegal for people to call you unsolicited.
I get emails too.
Emails are legal, but if anybody calls you, you just tell them, sir or ma'am, it's illegal for you to call me about Medicare. The rules are that you, the Medicare person, have to ask for someone to call you. Otherwise, they can't call you, just so you know. Now, all those calls and all that mail and all those commercials are about what you're looking at right now. It's called Medicare Advantage. Medicare Advantage plans. And this one is called PPO. So PPO means Preferred Provider Organization. So with the PPO, you have a booklet, a directory of doctors that you can see. You know, if you have a blue,
That would be like Kaiser.
no, Kaiser would be HMO, and we'll get to that in just a second.
Okay.
PPO would be like Anthem has a PPO and Blue Shield has a PPO. All of them but Kaiser have PPOs. That's where you have a directory of doctors, general doctors, family doctors, internal medicine doctors, and all the specialties, and you can go see any one of them. Now, without anybody's permission. So if you wanted to go see a cardiologist named Bill Smith in Van Nuys, and he's in the PPO directory, you can go see Bill Smith. Make sense so far?
Yep.
Good.
Yeah.
But if you have a Medicare Advantage PPO, you never ask a doctor, do you take Medicare? Because when you get the PPO, you've left the Medicare doctor world. You're no longer in the Medicare doctor world if you sign up for a Medicare Advantage PPO. Your world is now the insurance company's list of doctors, not Medicare's list of doctors.
So our doctor might not be included, in other words.
Correct. And this is what happens when people find out that their doctor is no longer available to them. Because the doctor was available to them in Medicare. But when they signed up for a Medicare Advantage plan, PPO in this case, then the client no longer had access to the Medicare doctor world, only the PPO directory of the insurance company. You see that?
Yeah, we took a long time to find our doctors, so that's really important to us.
Yes, it is. Now, except in an emergency, if you see a doctor outside the PPO directory, you will pay the bill. So let's say you were seeing Dr. Smith when you had Medicare, and you saw Dr. Smith twice a year for something, and then you signed up for a Medicare Advantage, and then you went back to see Dr. Smith, the bill was $250. You're going to pay for that because Dr. Smith wasn't in the PPO directory. Yes, he was Medicare, but he wasn't in the PPO. Is that making sense?
Yes,
Excellent.
I don't like it, but it makes sense.
Okie dokie. We'll have some solutions here, I hope, in a minute. But now, anybody who hasn't spoken up yet, please let me know if this doesn't make sense, because it's really a key point. So I'm going to just give you a second here. Anybody have a question?
This
I have
is
a question. Does each insurance company have their own PPO directory?
Great question, and the answer is yes.
and is this considered Part C?
It is.
Okay.
It's called Medicare Advantage, Medicare Part C, Medicare HMO, Medicare PPO. They all mean the same thing.
So you don't have the hospital coverage or anything from the original Medicare anymore?
Well, you still have hospital coverage, but it'll be different. It won't be the Medicare rules for hospitalization. It'll be the PPO's rules for hospitalization. And usually, and it varies by region, by county, by state, by insurance company, but usually with a Medicare PPO, you'll pay a dollar amount, a fixed dollar amount for the first, let's say, 5 days of hospitalization. So for example, the dollar amount might be $250 a day for 5 days, which means if you're in the hospital for 5 days, you'll pay the first $250 a day. And after 5 days, you pay $0.
Okay, this might be jumping ahead, but I tried looking up our doctors and our medications regarding both the PPO and the HMO, and it got so confusing, I just finally gave up.
I'm with you. I really understand how confusing that is. Hopefully the insurance broker or salesperson can assist you on that, because it's a challenge. Okay, now many PPOs, back to point number 3. So for doctors, for hospitalization, there's usually a dollar amount you pay per day. For doctors, there is what they call a copay, which would be, for example, $10, $20. For a specialist, usually it's more like $40. Or there's something called co-insurance, which is a percentage, like 20%. So copay means a dollar amount. $10, $20. Co-insurance means a percentage, 20%, 40%. All the Medicare Advantage PPOs have co-pays and co-insurance. And if you're hospitalized, you'll have a co-pay or co-insurance. They also have something called an out-of-pocket maximum, because you will be paying out of your own pocket for services. And if you were in a serious situation and you were paying those out-of-pocket expenses of hundreds or thousands of dollars, at some point you would go, wait, like, when does it stop? What's the maximum I'm going to have to pay out of my own pocket? And usually the answer is $4,000, $5,000, $6,000, something like that per year. Is that clear?
Yep.
Very good. Point number 4, many PPOs include a drug plan, and some include dental and vision and other benefits. Okay, so now we've
Okay.
covered 2. Go
I
ahead.
got one.
Sure.
We get some of our medication through patient assistance.
Mhm.
And one of the reasons we haven't switched over to another plan is because we're afraid we'll lose the patient assistance for
Okay.
medications that are like $1,000 a month and that sort of thing.
Now, did you
Um,
get
go
the
ahead.
patient, did you get the patient assistance because the cost of the drug was so high?
Correct.
Yeah, you won't lose that. That is a relationship between you and the manufacturer.
Excellent. Thank you.
You're welcome. Okay, so that's Medicare Advantage PPO. This is the one that's probably done, well, it's many people have the PPO. It's the number 1 choice is usually Medicare supplement. Maybe the number 2 or 3 choice is Medicare PPO. The next one is Medicare HMO. And this is the one you get the most mail about. The commercials you see on TV are almost entirely about this. The mail you get is about this usually. Even most of the phone calls you receive are about Medicare HMO. Now, what does that mean? Well, HMO means Health Maintenance Organization. The idea being that if it was very inexpensive for you to see a doctor, you would go often. And if you went often, you would maintain good health. So it's Health Maintenance Organization. Number 1, you choose a primary care doctor called the PCP. So unlike Medicare, original Medicare with a supplement where you can see any doctor you want who takes Medicare, or Medicare PPO where you can go see any doctor in the directory, with Medicare HMO, you go see one doctor. Dr. Jones, for example. So Dr. Jones is your primary care doctor, and you always go see Dr. Jones. You think you have the flu? Dr. Jones. You think you have a hernia? Dr. Jones. You've heard something funny in your chest? Now, sure, you'll probably end up seeing a cardiologist, but you're still going to Dr. Jones. First stop, always Dr. Jones. Okay? Now, if you need to see a specialist, then Dr. Jones will send you to a specialist in his group. So Dr. Jones has access to some specialists. And if you need to see one, you'll go see a specialist in that group. And this is where people sometimes are surprised and disappointed. Like in the example I gave earlier. So let's say you were always seeing a cardiologist named Klein. And now you have a Medicare Advantage plan, HMO, and the salesman said, your doctors are covered. And then you think, oh, I got a funny feeling in my chest. I think I'll go see Dr. Klein. You go see Dr. Klein. He submits a bill. He thinks you have Medicare. Dr. Klein does. He doesn't know you switched. He sends the bill to Medicare. Medicare says denied. The $400 bill has been denied. Why? Because you don't have Medicare anymore. You have a Medicare Advantage HMO. And you were supposed to see your primary care doctor, Jones, and then Jones would have sent you to his cardiologist. But because you didn't do that, you have to pay the whole bill yourself. Okay? Any question on that? Okay, so that is the key point that I wanted to make sure you knew, that which type of Medicare plan you choose has very dramatic consequences. Now, point number 4 is many HMOs include a drug plan. Some include dental and vision and other benefits. Okay. Now, why? Let me just see what the next slide is before I go into this next point. Okay,
Can you find out ahead of time what drugs are covered?
Yes, you can. It's published. Yes, you can. And
Thank you.
I do with my clients, because that would be another very big disappointment to find that you're in a Medicare Advantage HMO, which has its own drug plan, its own list of drugs, and you were taking Eliquis at $600 a prescription, retail, and you were only having to pay $65, but now you're paying $300 in the new plan because Eliquis isn't covered.
Gotcha.
So, yeah, thank you for bringing that up, by the way. That was a very important point.
Because they add up very quickly.
Oh, boy. You're so right. Okay, now we're going to just illustrate how a Medicare Advantage HMO works. So in the center, you see we have a primary care physician. And that primary care physician has in his or her group various specialists, like a cardiologist, like a urologist, like a physical therapist, surgeons, oncologists, gynecologists. There are several people in these professions, in these specialties, that are affiliated with your primary care doctor. And they're all local people. So when you see your primary care doctor, let's say you have a funny feeling in your chest. So you make an appointment to go see your primary care doctor. He or she does an evaluation. That person may then order tests to be done. And let's say they do an EKG or an ultrasound. That comes back a week or two later. You go back, you make another appointment to see your primary care doctor. You go back in again. That primary care doctor says, you should see a cardiologist, and I'm going to refer you to one. So then you now make an appointment with a cardiologist to go see them. So that's how it works if you have an HMO.
Okay,
Now,
so what if you don't like the cardiologist?
good question. Well, it's not going to be just one cardiologist. There will be several. So you could change your cardiologist. You can also change your primary care physician. When you sign up for a Medicare HMO, there might be 30 primary care physicians that you can choose in your area. And if you don't like the primary care physician you chose first, every month you can change to a new one. And
Thank you.
same with the specialist. Okay,
Okay,
good.
But question, if you're on a supplement, then you're not required to go through a PCP and you can self-refer?
Yes. And remind me to get back to why people do HMOs. I just don't want to forget that point. Here's how it works in what I think is the real world. Person has some symptoms. So they're going to call their doctor and say, I have these symptoms, or go see their doctor, call them and say, what should I do? And your doctor would say, go see Dr. Horowitz. He's an outstanding cardiologist. Go see Horowitz. Okay, great. You go see Horowitz. Medicare doctor, no problem. Or you have some symptoms and you tell your friends or your family, and they say, like, your knee is hurting. They say, oh, I know this great orthopedic surgeon. I had knee replacement 3 years ago. I was referred to this orthopedic surgeon. He was great. He does lots of the basketball players and so forth. And it's called the Curlin Job Institute in Inglewood. I think you should go there. They do a great job. And you're like, yeah, that I want the best. I want it to be quick and I want the best. No, it's not how it works. That's how it works with Medicare and Medicare supplement. You could probably go see the Curlin Job Institute. But if you're with HMO, chances are they're not in your HMO. You go see a primary care doctor, then that doctor refers you to a knee specialist. So the reason I bring that up is because in the real world, we ask for referrals. But that doesn't really work. It doesn't work at all, really, in the HMO world, because the only referral that matters is the one that your primary care doctor gives you. Does that make sense?
Yep, so why do people have HMOs then?
And I'll tell you, it's about the cost. So here's what Medicare normally costs. Medicare Part A is hospital. It costs $0. The premium monthly is $0. Medicare Part B is doctors, and the minimum monthly premium is $170. So just make a note, Medicare Part B, $170 a month. Now, usually if you get an HMO, there's no premium, no extra premium. So your entire monthly premium is $170. Usually that's the case with PPO. Not all the time, but usually the monthly premium is $0 because you're going to have to spend when you go see doctors. So your monthly premium usually, if you have a Medicare PPO, is still only $170 a month. But a Medicare supplement has its own separate premium that's somewhere between, $130 to $250 a month, depending on how old you are.
So that would be the Medigap that you,
That's Medigap, also called Medicare supplement. So Medigap policies have an extra premium that you would have to pay. And so a person's concern about being able to pay that premium is what would lead them to an HMO or a PPO. That's why they would do an HMO or PPO.
Excuse me,
Yes.
I used to pay 130 that they would take from my social security check, but then I changed the plan with one of the like a scan, and now that money is not taken from my my check.
How much is taken from your check?
Nothing.
Well, there's no nothing. You might want to look at that check again. But when you say it was 130, how many years ago was that?
Oh, up to last year. Well, 143 became 143.
That's right. So it's gone up. Medicare Part B premiums, Medicare Part B have gone up every year. And this year is $170. Next year is going to go down a little bit to about $164. So now Scan would charge no extra premium on top of the Part B. And they also gave you back some money. Does that sound familiar?
They didn't give me any money back, but I'm with Memorial Care as the medical group. So it's HMO. Yeah. But I don't pay it, they don't take any, I mean, as far as I know, it was $143 that they took. Now it's a year since I have the scan, they don't take it. It's a special plan they have.
Yeah, I'm familiar with that plan. You just need to review your Medicare, your Social Security bill, your Social Security benefits, because it's not $0.
Okay.
Just take another look at it. And if you have any questions about it, just call me and I'd be happy to review it with you.
Thank you.
You're welcome. Any other questions? Great questions so far. Okay, fine.
if you do Medigap, how do you find out about it and how is it paid for?
Yeah, so Medigap insurance is paid monthly, usually. There are discounts, like if it's two people, usually there's a monthly discount, 7% often. If you have Medicare HMO right now, and you want to switch to Medigap or Medicare supplement, you can do it, but the only company that will let you do it with no medical questions at all, like guaranteed, is Blue Shield up through December 31st. Usually, always almost, if you want to switch from a Medicare Advantage HMO or PPO to Medigap or Medicare supplement, it requires medical questions. You have to fill out a questionnaire, a health history.
Okay, we don't have either one, but I like the Medicare supplement because it will allow us to see our doctors that we have, correct?
That's correct. And just one note, by the way, that if you want to keep your costs as low as you can act in California, you can actually change from one Medicare supplement plan to another every year in your birthday month. So let's say you're with Anthem and your premium is $180 a month, but you shop with me or someone else and you find out United Healthcare is $160 a month, $20 less. During your birthday month, you can switch from one company to another company, no medical questions.
Okay, that 160, would that come from your Medicare deduction on your
No,
check from Medicare, or how does that
no, the
work?
Medicare supplement plans cannot be subtracted from your Social Security, if that's what you're asking.
So you're still paying that?
You are. You pay out of your own checkbook.
Okay, and then Medicare also takes,
Right.
because
So
you still have A and B, right?
correct. So if you had a Medicare supplement, you would pay $170 a month for Medicare Part B. Depending on your age, let's say you spend $150 a month for a supplement. And drug plans these days have gotten very inexpensive, maybe $10. So $170 and $150 is $320, plus $10 is $330. So for $330 a month, the person could see any Medicare doctor in the country. And that, by the way, the premium is a total guess, depends on your age.
Sure.
Okay, but in this example, you're spending $330 a month. You can see any Medicare doctor in the country. Your total out-of-pocket expense for covered services would be the Part B deductible of $226. It's as good as it gets. I mean, you've never probably in your life had medical insurance that was that good.
No, well, we're paying more than that deductible just for the drugs every month.
I'm only talking premiums here.
Okay,
Now, on the drug plan, when you have a drug plan, yes, you have possibly a premium for the drug plan of like $10, but you also pay when you go get the drugs. That's
okay, so you pay a deductible.
exactly. Not for all drugs. For what they call preferred generic drugs, you would pay usually zero or a very low, not usually zero, I retract that, but a very low cost, like $5, $10.
What I meant was that our drug out-of-pocket cost monthly is way more than the cost of a supplement premium would be, plus the copays if the drug plan got us down to $10 a prescription, you know what I mean?
I do.
Because we have like, I think 18 prescriptions every month.
I see. That can be
So,
quite large.
Yeah,
By the way, I urge you to shop your drug plan every year. Because you will find more often than not that the drug plan that was cheapest this year may not even be close to cheapest next year. For example, I have my drug plan with WellCare. I do take Eliquis. It's an expensive drug. I just got a notice from my drug plan, WellCare, that Eliquis is no longer a preferred drug, which means it was now double the price. So I instantly went shopping for a new drug plan, and sure enough, I cut my price and cost in half. So if you have a drug plan and you have prescriptions, it is well worth your time to either research a new drug plan every year during open enrollment right now, or have your broker research it. It's a
Okay.
pain. It's a pain for the broker to do it, like a real pain, but it's their job.
okay, I'm gonna get uncomfortable for a minute with you. How do we find an advocate that we can trust? Obviously, you came from Allison, so I already tend to trust you. But how do we know that that advocate or broker isn't just out to make a buck on Medicare, you know what I'm saying, and doesn't give a darn about whether we get the correct medications or the correct insurance or not?
Yeah, of course, I don't have a really good answer for that, but I think if you have a referral, you're certainly in better shape than if you took a cold call. Because the person making the cold call has already broken the rules.
Exactly. Well, even if I go looking for somebody, it's still, if it's not somebody referred, it's always uncomfortable, and you always wonder in the back of your mind, is this person going to be helpful or not? Kind of like with a doctor, right?
Yeah, kind of like that. I personally know a lot of Medicare brokers, all fine people. So my experience is very positive with Medicare brokers. You
Do
know,
you do it? Do you do it also, or do
I
you
do.
refer us? You do? Okay,
Yes, I
cool.
do.
So we'll get your info at the end, right?
It'll be the last slide.
Perfect. Thanks.
You're welcome. Okay,
Also in Laguna Woods, there is a Council of Aging.
that's
and
right.
They have advocates that is impartial and free.
Perfect.
I have an appointment with one of them tomorrow, but it's mostly by phone.
Yes.
They have 2 days now that you can go there personally and do it.
Terrific. Thank you for bringing that up.
So it's called Council of Aging.
Council of Aging has many services for people of aging, and one of them is this. They have advocates that are completely free and completely unbiased, and they help you to choose your plan.
Okay, we're not in Laguna Woods, so would they still be available to us?
I'm not sure, my dear. I don't know.
Okay, thank you.
I see there was a chat question. Can you ever be responsible for more than your out-of-pocket maximum? Yes, that could happen. Couple ways. So just kind of frame the question. So we're talking about Medicare Advantage PPO or Medicare Advantage HMO. The out-of-pocket maximum refers to if you are seeing in-network doctors. In other words, doctors who are in the PPO directory or doctors that you have been referred to in the HMO directory. If you see doctors outside of those directories, then there is no out-of-pocket maximum. You're paying for everything. I hope that answers your question. There's a couple other ways I could have answered that question, but hopefully that's what you were looking for. But if you're in the PPO doctor network, then no, you would not have expenses above the out-of-pocket maximum. except drug costs would not count towards the out-of-pocket maximum. And sometimes office visits don't count towards the out-of-pocket maximum, sometimes. Hopefully I answered that question. And I did. Thank you for the chat note. Okay. Let's see what the next slide is. Questions. So we covered quite a bit of ground there. Small part of the whole pie, but a significant slice of the pie. Does anybody have any questions at this point?
There's one question in the chat, Mark.
Oh, I think I answered it, but
It's a new one.
it doesn't show up on mine.
No,
Oh, can you share which drug plan you found for a good price on Eliquis? Cigna. Yeah, the way I search for drug plans, and you're welcome to do the same thing. I go to Medicare.gov. There's a box that says, look for drug plans. I fill in my zip code. I list the drug, the dosage, the frequency for all the drugs that I take. I list the pharmacies that I would want considered: CVS, Rite Aid, Walgreens, Costco, mail order. And then what happens? I click a button and I get a list of the cheapest drug plan at the very top of the list. Not the cheapest premium necessarily, the cheapest plan when you look at the premium plus the cost of drugs, like the true cost of a drug plan, premium plus cost of drugs. And it'll tell you right up front which is the cheapest, and it just lists them all from cheapest on down. Did that elaborate satisfactorily on your question? Hopefully it did. Okay, any other questions? Allison, anything you would like to add or ask at this point?
I think your presentation, Mark, was excellent. Very, very informative. Thank you very much.
You're welcome. So this is me. You're welcome to call or email. Happy to help. Be aware, here's 2 things you should know. The Medicare open enrollment ends December 7th. And that's if you want to change your Medicare Advantage plan to a different Medicare Advantage plan. Like, let's say you have Medicare HMO right now, and you cannot see a specialist that you want to see. Well, maybe that specialist is available in a PPO. And during open enrollment, you can switch to a Medicare Advantage PPO and thereby have access to that specialist. Does that make sense? Give me a thumbs up if that made sense to anybody.
Yep.
Good. Okay. Very
Your-
important.
Your
December
information is
7th.
not on the screen, just says questions. Your
Thank you.
information is not on the screen.
How about now?
Oh, yes, now, yes.
Thank you for that. So,
Mark?
yes,
Can you also go over, just in case somebody, let's say, they signed up for an HMO and now after listening to your presentation, they're like, uh-oh, I goofed on this one. Can you talk a little bit about what the options are?
sure. So if a person has a Medicare HMO right now, 3 things they can do. 1, they can switch to a different Medicare HMO and maybe find that specialist they're looking for, or switch to a Medicare Advantage PPO. And if that specialist is in that directory, or they can go back to original Medicare, where they can see any Medicare doctor and purchase, if they want to, a Medicare supplement plan. One of 2 ways: either answer medical questions and because there's no problem, or Blue Shield offers this guaranteed program where you can switch to a Medicare supplement in November and December. So I'm going to cover all that one more time because that's a lot of information. Let's say the situation is a person has a Medicare Advantage HMO right now and they'd like to, and there's a problem with it. Maybe usually they can't see the doctor they want. Either they find that doctor in another Medicare HMO, possibly, or they find that doctor in a Medicare PPO. And if that's the case, you can switch from your Medicare HMO to Medicare PPO before December 7th. Or,
Okay.
go ahead.
Mark?
Yes.
Okay, so say you don't have a plan right now, but you would like one, but you want to see your doctors that you have established. So you would recommend a supplement plan?
Well, that's the surest way of having all those doctors available to you, because most doctors take Medicare. But if you want to see if there's a Medicare PPO, you can either go to the Medicare insurance company website and search yourself, or call your broker, or find a helpful broker, and they can research for you which Medicare PPO plans that doctor is in.
Mark,
Yes.
do you know any of these insurance or plans and things that accept alternative, except, that instead of just medicine, you can go for other different kinds of doctors that accept alternative?
I don't. I get asked that very often. I think it's called Doctor of Osteopathy, DOs
Yeah.
are more non-traditional than MDs. And there are DOs who accept Medicare, plenty of them. But I know what you're asking for, and usually the answer is no, they don't. Those doctors aren't normally Medicare providers for a couple of reasons. One is that some of the treatments that they offer wouldn't be covered by Medicare.
Yeah.
For example, sometimes I run into where a person had a blood test, and part of the blood test was a vitamin D test, not covered. So, there might have been 20 things tested on that blood test, and 19 of them were covered. But that vitamin D test wasn't covered because Medicare doesn't recognize that as
What about chiropractic?
limited benefits on chiropractic. Chiropractic gets covered by Medicare. There's one specific, basically spinal correction things. So there is some chiropractic benefit. You would need to find a Medicare chiropractor. They exist. You would be careful not to get like a chest, like an x-ray at the chiropractor, though. That might not be covered. But the spinal manipulation frequently is. And the chiropractor you see will know all about this. They'll know exactly what Medicare does and does not cover, because they encounter it daily. Does that make sense?
Yes, thank you.
Okay, so Allison, I want to make sure that I adequately answered that question about if a person has Medicare HMO right now, what are their choices?
You did, and then my second part of that question is, let's say they don't figure this out until January 2nd. Is there any, after open enrollment, is there anything they can do after that?
Yeah, so there's a couple things. One thing is there's actually 2 enrollment periods. We're not supposed to advertise, we're not allowed to advertise the second one. But from January 1st to March 31st, there's a second enrollment period where you could change, one time you can change from your Medicare Advantage plan to a different Medicare Advantage plan. So let's say you have a Medicare HMO, and on January 10th, you realize, oh my gosh, I can't see Dr. Smith. Is Dr. Smith in a PPO? Yes, he's in Aetna's PPO. Good, can you switch? Yes. Because there's the second enrollment period where people can change their Medicare Advantage to a different Medicare Advantage because they realize they made a mistake. And the government's graciously given us this second opportunity to fix things. During that second open enrollment from January 1st to March 31st, you can also opt out of Medicare Advantage plans as well and just go back to original Medicare. You still have to figure out how to get a supplement. That might be a problem, but you could go back to original Medicare, just the basic Medicare program. And one other thing is if you had Medicare, this gets a little complicated. I'm sorry, it's just a complicated subject. If you had, let's say, a Medicare supplement and you got a phone call and someone convinced you to switch to a Medicare Advantage and you found out your doctor wasn't covered, you have 1 year to switch back, no questions asked. Does that make sense? Or was that confusing at all to anyone?
No, it was clear.
Okay, good.
Thank you.
Allison, does that
Perfect.
answer it?
It sure does. Thank you, Mark.
See, it's such a complicated subject. And I urge you to, it doesn't have to be me. There are a lot of competent Medicare brokers, but it really helps to have someone who knows their way around Medicare because it's just extraordinarily complicated subject. Okay,
One last question.
sure.
What was the drug plan that you said gave you a good Eliquis pricing?
Cigna, I forget which one. The Cigna has several plans.
Okay, I can look it up.
But if you go to Medicare.gov or have your
Yes.
broker go to Medicare.gov and type in the Eliquis, the prescription and the pharmacies and your zip code, it'll pop up number one. It'll say zip code or Cigna, blah, blah, blah.
Perfect. Appreciate it. Thank you.
Yeah, you're welcome.
I just saw a question pop up on chat.
Oh, let's see. I see 4 of them. Oh my goodness. Thanks for mentioning that. Council of Aging, HICAP 714.
No,
wanna
that's
write-
just information on Council of Aging. That's the number if somebody wants to call.
Good. Second one is from Joanne. If a person has Medi-Cal and original Medicare, can they see any doctor who takes Medicare? No, you'll be working in the Medi-Cal directory of doctors, like an HMO, basically.
Oh,
Yeah. And Kim, to everyone, if you have Medicare A only and a secondary or supplement, are you still well covered without B? You cannot have a supplement or Medicare Advantage without Part B. You must have Medicare A and B first, period. Then you can get a Medicare Advantage or a Medicare supplement, but you must have Part B. I hope that's what you meant. If you didn't, if you meant something different, let me know. Okay, let me scroll through these questions real quick. Good, good. Oh, someone says a United Healthcare price went up. Yeah, the Medicare supplement prices go up every year a little bit.
So, according to you, which one of these plans, just Medicare by itself, or with supplement or advantage, is the best, or it depends on your needs?
Unfortunately, my mind was kind of partly on a question I was seeing. Ask me that question again, please.
So according to you, is it better to have just Medicare, have Medicare and supplement, or have Medicare Advantage?
Sure. And I look at this strictly from a claim point of view. So I'm not looking at it from the balance in your savings account or anything else like that, strictly from a claims point of view. So if you have access to the most number of doctors anywhere in the country, and for a covered expense, your total out-of-pocket cost for the year is $233, there is nothing that comes close to that. That's as good a plan as you could possibly have. So Medicare, original Medicare, plus a Medicare supplement offers the most likely happy outcome if you have a medical event. And this has been proven to me numerous times over 30-something years.
And for drugs as well?
Well, I'll answer that question in just a second.
Okay,
For example, like I had a client who was, twice this has happened, who is out of state, had a problem. In both cases, it was one was a hip, one was a knee. They wanted to solve the problem where they were because they were out of town for an extended period of time. One person went and got a bunch of tests done. I had to say, sorry, you'll pay for all those tests because they had a Medicare HMO. So because they had a Medicare HMO, what they needed to do was come back to Los Angeles and see their primary care doctor and get referred to a specialist. But if they had Medicare, they could have stayed where they were and seen a knee specialist or a hip specialist right there in the town where they were. It would have been just like if they were here in LA, no difference. So that's why I say when it comes to claims, my experience is that there's nothing better than original Medicare plus a supplement. Now, what can you get with the Medicare HMO that you can't get with a supplement? Well, many Medicare HMOs and PPOs offer a free dental plan. Usually not a great dental plan, but it's 2 cleanings a year, x-rays. That's kind of nice. They frequently offer a little vision plan. It's not the best vision plan, but it's free and it's a good start. Sometimes they offer hearing benefit, where you can go get a hearing exam and a discount on maybe a certain brand of hearing aid. There might be a thing where you can buy over-the-counter things online from CVS or something, and maybe $50 every 3 months. You can buy toothpaste, toothbrush, cold medicine, things like that. So the HMOs have these little things that are attached to the plan that a person might find valuable or, very valuable. So it's kind of a hard question to answer, uniformly, but I just look at it from claims. When you have that big medical event, do you want access to the best? And do you want to spend the minimum? And if the answer is yes, I want access to the best, and yes, I want to spend the minimum, then the answer is original Medicare plus a supplement.
But then you pay monthly like 143 or 170, right?
Correct. That's right. So I'm not taking into consideration, your premium. I'm just saying from a claims point of view,
Claims, okay.
if something big happens, what would you want? And the answer is access to most doctors and spend the minimum.
Thank you.
well,
Yeah.
is that gonna help us make the co-pays at our doctors that we go to?
Well, when you have a Medicare supplement, it depends on which one, but if you have Plan F or Plan G, you don't have co-pays. You pay zero. You have one annual deductible of $233 for doctors. That's it. So
Okay.
you can,
The answer is yes, it pays whatever co-pays we were paying just from the Medicare.
yeah, the supplement pays all that. Everything that you would have had to pay normally through Medicare, the supplement pays. If Medicare approves it and pays its share, the supplement is going to move in and pay the balance. The part
Okay,
that you would,
let me give you an example. My wife gets an injection every 3 months because of her Parkinson's. She gets a Botox injection in her shoulders. And our cost for that, our copay for that is 300 and something, around 325 every 3 months. So we're out like $1,200 a year for just for that one procedure. So how would we know if that would be covered in a Part G?
what do you have now? Original Medicare?
Original Medicare.
Is Medicare covering it?
No, they pay our office visit, but they don't pay the procedure.
So it's not a covered expense by Medicare.
Well, let me rephrase that. The actual cost is $1,000 each time she gets the injection, but it's lowered to $325. I'm
Because it's-
guessing because of Medicare.
Right, so then the supplement would pay the rest of it.
Wow, that's worth the cost of the supplement right there.
Correct.
I mean, that's just one of her doctors. She's got several doctors, so I'll be calling you.
Okay. And we'll price it out. By the way, if you do call me, we'll give you the facts. You make up your mind. Perfectly fine.
Excellent.
Yeah, any other questions?
Are your services free to us?
Yes. Yeah. No Medicare broker is allowed to charge like a consulting fee, not permitted.
How do you
Medicare-
make a living then?
Because the insurance companies compensate the broker.
Perfect.
Yeah, in all cases.
So does that influence your decision on your recommendations?
Oddly enough, the way for me to make the biggest commission is Medicare HMO.
Huh. That is odd.
Crazy, because there's not even a premium. There's not even a premium, and I make the highest commission.
And it
That's,
wouldn't
that's the
wouldn't be
government.
your first recommendation, probably either.
And it's the one I always tell people, like, you know, if they can afford a Medicare supplement, they should do that, not the Medicare HMO. But the Medicare HMO pays way more. That's why you're getting so much mail on it.
Is there such a thing as an affordable dental plan for seniors that is good?
I didn't catch one of the words. What was it before dental, you said?
Is there such a thing as an
Affordable?
affordable dental plan?
Well, affordable, I think, yes, but you know, dental plans, they have a ceiling on benefits, like $1,000, $1,500. So it's it's not certain that a dental plan will benefit you. What I tell people is, I mean, dental plans will cost somewhere between, you know, $15, $20 for an HMO, up to $45, $50, $60 for a PPO per month. So now, if you're spending $45 a month, that's like what, like $500 something a year, $600 a year almost. Well, at least get your teeth cleaned twice and recover some of that expense. My dentist charges, I think, $130 per cleaning, not counting x-rays, not counting any other things. So I'm into him for maybe almost $300 a year for cleanings. Well, if my premiums come to $600 and my cleanings came to $300, at least I got some of my money back. And now if I really need serious work, I have a dental plan. So I think the dental plan is worth it as long as you do get those 2 cleanings each year. If you don't, you're just throwing your money away.
Okay, thank you.
Sure.
And then about prescriptions, we were talking about prescription plan with the Part D.
Part D, as in drug.
Right. Well, you recommended the Medicare supplement plus a drug plan.
Yeah. Would you like me to elaborate a little bit on that?
Yes, please.
So in the drug plan, and this is every year doing open enrollment, this is most of my work is researching drug plans for clients. Because it's important to review it really every year. Because what they call the formulary, the drug, there's a thing called a formulary, and that's the list of drugs that the insurance company offers. Now, they have to cover drugs in every therapeutic class. So if they don't cover Eliquis, for example, they have to cover something like it. But because the formularies, the insurance company's drug list changes possibly every year, or your drug list changes sometimes on a yearly basis, or the insurance drug plan premium changed. There's so many moving parts that it's just really a good idea for you to check your drug plan every year. Now, that's if you have a separate drug plan. If you have a Medicare HMO, you need to contact your Medicare HMO company and make sure that the drugs that were covered this year will be covered next year.
Well, I'm thinking specifically about drugs that there is no generic for that are very expensive. And then psychiatric drugs that have taken years to establish the effectiveness. And you can't really use one that's like it. You have to use that specific drug. You know what I mean?
Yeah, I do know what you mean. And there are some potential solutions for that. Your doctor has the right to make a case for why drug X is vital and why you must have it. I don't think I've had a high percentage of those work out, but they sometimes do. And other than that, it's just an imperfect system, I'm sorry to say.
That's why we're on patient assistance with a couple of the medications,
Yeah.
because there is no generic and she needs that specific drug.
Oh, man, sometimes the cost of the drug is brutal.
You got that right.
Okay, any other questions?
Thank you so much, Mark. I really appreciate this
welcome.
talk and your time.
What a great group.